Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Thanks to all those listening on the audio podcast. We got some exciting news about that coming up. I'm your host, plastic surgeon, Dr. Bruce Hermann. With me is Sarah. Hi, Sarah.
Hi, what's up?
Not much. It's Friday.
Yeah, it's Friday.
Travis, you know I'm going to call you out. What's up, buddy?
Not much. What's up with you?
Not much. Same old. I actually had a really busy week. Like, it was almost too busy. I had a bunch of add-on surgery. I was running around crazy. So I'm looking forward to the weekend, although I'm on call, so that sucks. Hopefully it won't be busy.
I'm looking forward to have my foot
I'm looking forward to at least, I don't have
out.
anything planned work-wise right now, but we'll
nice.
see how it goes.
Good.
But you guys have anything exciting this week or normal weeks?
Nah, normal on my end.
It was normal, Sarah?
Yeah, pretty normal. The only thing new with me is that I'm going to graduate school.
I know,
next
that's
week.
so awesome. Sarah's getting her master's, which is cool. And I was telling Sarah this before we started the show that my wife did the same exact thing. Got her master's. She got her master's in business online while she was working too. And so it took her a couple years. How long was it? 2 or 3 years?
I think it's 2.
Yeah.
Yeah.
That's great. I'm super happy.
I think 3 classes a semester.
I think it's fantastic.
Congrats.
Awesome.
Congrats.
Yeah.
So I was talking about the audio podcast. So for those who watch this on video, all of our the audio transcript of these get uploaded to, I guess, a lot of, Travis, you know more than I do, gets uploaded to all the little podcast, Spotify and Apple Podcasts and all that.
Transistor and
yeah.
all those guys.
So I was actually talking to one of our media people, and I think I'm going to do, and it's going to take me a while to do this, but we talk about these stories about these medical outcomes. So I was going to do some audio podcasts, more in a narrative form for those, and then kind of put those out in addition to our shows. So I don't know if we'll do them on YouTube though. Do people put audio podcasts on YouTube? Probably not, right? Or do they?
They have. I've seen them before. They just have
a lot of podcasts. A lot of podcasts.
I think those are on different film.
Yeah, they put them on YouTube, like Joe Rogan.
Yeah, but that's what we're doing.
I know, but they're still set up in more of a studio setting, like what it is behind the screen.
I get what you mean, though, with just straight audio. Maybe just a show logo and just audio.
Yeah.
That's all.
Yeah.
I got to think about that if we're going to do it. But anyway, I have one of my media people. She's like, yeah, because I was telling her about, we were just talking about the audio side of this and how I don't even really, look and see. I have no idea if people listen to it because we just kind of focus on the video. And so anyway, she was like, you need to be doing that. And I was like, well, we should add to it. So in my spare time, I'm going to try and crank out some of these audio podcasts.
In your little spare time?
Yeah, I figured it'd be something to do on the weekend. Well, it's, honestly, it's like I have all these projects, but they're all kind of intermingled. So, for example, I don't have to do a ton of research because I can go back and look at some of our video segments and just convert them into the more narrative form. So it's not like I'm having to come up with stuff from scratch,
Yeah.
And the same thing when I write for one of the local newspapers, and my wife's like, why do you do that? Because they don't pay me anything. I was like, well, it's not that big of a deal because I'm always doing medical topics anyway, and so I just grab one of the medical topics we do and convert it into
Yeah. Well, I feel like it's also a way for people to be like, Herman, I know him. Even because just because they see your name in the newspaper.
It's funny. We started
notoriety.
When we just moved into that new office, and we have a TV in the waiting room, and so we actually run the show on there, and it's everyone asks about it. It's so funny. Not everyone, but I would say many patients during the day will be like, I saw your show up there. Yeah. And I was like, oh yeah, that's cool. Because they run up there. They don't have the audio on, but they have the subtitles. So we're up there.
We're on after Oprah.
Me and Travis are up there chatting away all day in my office. So. All right, well, let's jump into some segments today. There's some pretty good ones. I got 2 good ones, and Sarah's got a really good one too. And I actually am excited to talk about her. Well, it's kind of a sad story, but I think there's a lot to talk about.
I'm not going to dwell on that one.
Yeah, don't dwell on that part. So, all right, so let's jump into the first segment that I got, and this is a controversial one. So, you guys, we got to be serious, and we don't have to be super serious, but this is a controversial one that we've talked about before, and I'm going to start out with just the title, which is the first major medical society in the United States has come out in opposition of gender transition surgery in kids. And that's kind of a big deal. We'll talk about why in a minute. And we actually did a segment on this. It was
I remember us talking about
yeah,
it.
It was whenever this started really picking up steam in the U.S. news. We talked about gender transition in kids, and the segment that we did was specifically talking about like doing like puberty blockers or hormone therapy and surgery, because and throw up just the picture. Yeah, so that's the one that we did. Oh, it's from April. So if you guys want to look at that, I'm sure my media people can put a link here at this part of the video to go to that segment. And what we were talking about was some of like the more irreversible and permanent treatments for gender transition in kids, like which would be like the hormone therapy to stop puberty and surgery. And we pulled in a bunch of articles and tried to be very objective about it. And I think we were all kind of on the same boat, that we were kind of against that. Well, I don't want to speak for you guys, but after watching this segment, we all seem to be on the same page. I personally was against it for reasons which I'll kind of circle back around at the end. So that was like a year and a half ago. And, this all started gaining popularity in Europe. That's where it all like started, was Europe, like this gender transition in kids. And then in the past few years, like it started to pick up a little bit of steam in America, and you started seeing it more in the media. That's why I did that segment back then, is like you started seeing it more often, even though it wasn't maybe, something that was happening all the time. And, there's a lot of like medical societies in America that have really embraced this, including the American Medical Association, the American Academy of Pediatrics, the Endocrine Society, the American Academy of Child and Adolescent Psychology. And also, I didn't have this information when we did that segment, but the number of kids and kids would be younger than 18 in the U.S. that have gotten transition surgery has actually gone up tremendously in the past few years. So I was able to actually find some data on that. I didn't have that when we did that segment the last time, because I think at the very end we were asking about that. So this is specifically looking at surgery, not hormone therapy. But in 2016, there was around 100 kids that had transition surgery. Now most of these are top surgeries. Okay. Yeah, almost all of these are female to male transition. So what would that be? Cis girls going to trans boys?
I don't know.
Yeah, I'm trying to get the terminology right. These are not like, for the most part, these are not like the genital surgeries. It's like the top surgeries, just so people know. So in 2016 there was around 100. 2019 there was around 500. And last year in 2023 there was around 800.
When you say adolescents, what's the age of that?
So it's 17 or younger.
Okay.
Younger than 18. So when I say kids, I'm talking about, like, to me, like legal adult 18. So this is kids like 17 and younger. So like 13.
What's the youngest?
Probably 13, I would guess. That's a good question. It's 12 or 13. Like, it's pretty young. Like, yeah. So, so it's picking up a lot of steam in the United States. But in the past year, Europe, who was like all on board with this, has really started to tap the brakes and start to look and see, okay, is this actually a good idea? Because there's a lot of, and there's an article, throw that article up there for people, because this actually had a lot of information about it. This was from last year. Yeah, it was about 1 year ago. This article basically was citing a bunch of changes in the European health system to kind of tap the brakes on kids getting the more like irreversible parts of gender transition, such as the hormones and the surgery. And it talked about a few things. One was a big article out of Sweden. Throw that up there if people want to look at it. Travis, that's the next one. Yeah, this is an article out of Sweden, which had shared a very similar kind of outlook to the CAS review, which throw that next picture up there, Travis, just in case people want to look this up. Yeah, CAS review. So the CAS review was an independent review commission in the United Kingdom that went on for like a year, that really took a deep dive into this gender transition therapies in kids. Because I don't know, I mean, to me it all seemed to kind of pop up very quickly, and suddenly like this thing was kind of mainstream, maybe without a lot of study. Right. And if you remember, man, it's so funny. I went back and watched the whole segment we did a year and a half ago. Like, one of my biggest complaints about this was that I felt like that there wasn't a lot of good research on it. Like the research was very thin. Like when we do stuff in medicine, it's almost always based on research. Like a consensus of research that says if you're going to do therapy A, that it, you know, one, it's effective, and two, it doesn't have, you know, an exorbitant amount of risks. And it can't be just like one study with like one patient. It has to be either a really big study or it has to be lots of smaller studies. And the data was just really not there, in my opinion, because I did look through it. I mean, like everything, I like to go through and look at data and see, okay, like I don't buy what someone's trying to sell me. I want to know on my own by looking at the source.
They're pretty much like making this a big deal just because it is so controversial, it sounds like.
I'm making a big deal?
No. Like the media publishing this stuff. It's like they're making it a big deal.
I do think it's because
it is controversial.
This is going to be said more than once, but I think it's all been politicized a lot. It's like, you know, this is going to happen and you're going to like it, and it's more political than research based. So anyway, the CAS review is this very big independent review. It's an independent review commission looking at this phenomenon of gender transition in kids in the UK. And it came out with like a pretty negative kind of outlook. It said it had a very big concern about the sheer number of kids that were seeking out these transition therapies, and, you know, questions of, you know, is this real, or is this like a fad with kids, or is it parent pressure? It brought up that there was very weak evidence for the benefits of hormone surgery. It's one of the things that I said. They thought that there was overdiagnosing by the doctors, and at the end it said that they would issue extreme caution for the use of any hormone therapies for kids, as well as surgery. So that's kind of a big change from the past years in Europe, where this was kind of a free-for-all. And, you know, here in America, outside of, I guess, like conservative lawmakers, there hasn't really been like a lot of people like in opposition of this. You know, it's like the AMA got on board with it, you know, the Academy of Pediatrics, the Endocrine Society. And I'm not a big fan of medical societies. Like, I'm not even a member of my own medical society. Right. And I'm not a member of the AMA. Like, I mean, not to like derail my own conversation. A lot of these medical societies are more about like, you know, academics and doing stuff just because. And I'm just, you know, I'm a clinical guy, and I just don't see like the big need for that. So I'm not a member of any of these societies. But all these societies kind of jumped on board with it until this week, when the first major medical society in the United States spoke up in opposition specifically for gender surgery in kids. Any guesses which medical society it was?
No.
Travis?
I do not know.
You might know because I have this smile. It was actually the American Society of Plastic Surgeons.
Oh.
Yeah, the American Society of Plastic Surgeons just recently came out, and there's a picture of that. Travis, throw that up. So the ASPS has not endorsed any organization's practice recommendations for the treatment of adolescents with gender dysphoria. ASPS currently understands that there is considerable uncertainty as to the long-term efficacy for the use of chest and genital surgical interventions for the treatment of adolescents with gender dysphoria, and the existing evidence base is viewed as low quality, low certainty. Who said that before? The patient population requires specific considerations, which it's a big deal. I mean, you know, because plastic surgeons are the ones that do these surgeries. Yeah. You know, like for the governing board for plastic surgeons to come out and say, hey, we don't support this is a big deal. And it's going to be interesting to see if like this is kind of like maybe a turning of the tide in the United States.
Well, I mean, it makes sense. They're the ones who are treating these patients, not.
Yeah. It's not like other people. Yeah. Well, I mean, there's definitely other people.
I guess a pediatrician.
Right. There's definitely other people involved when a kid has gender dysphoria, for sure. Like the pediatrician's going to be involved as maybe like a gatekeeper, and then there's going to be, you know, potentially psychology or psychiatry and psychology, and then perhaps endocrine with like the hormones. You know, it's a lot of the people that are coming out in support that came out in support.
I feel like plastic surgery just is like such the most physical part of their change, and I feel like they're a part of the biggest stage or like transition for them. Yeah. So it's like they see the most issue with it.
I was kind of surprised that they, you know, because they could have said nothing, right? Like if you're against it and you don't want to get like the backlash, just remain neutral. But actually for them to come out against it, I think is, I mean, honestly, I'm kind of impressed, you know, with them for doing.
You agree with them?
I do agree with them. Yeah, I actually agree with the medical society. I don't know. That's weird.
Maybe they'll call you up now.
Well, you know, it's funny.
Be the spokesperson.
No, I mean, so I could join the ASPS. It's just a matter of like going through the process of joining it. You know, because I'm a board certified plastic surgeon. 92% of board certified plastic surgeons are members of ASPS. So I'm in the 8%. And it's just because I didn't care.
Yeah.
Like, it's not like, it doesn't necessarily hurt.
It's kind of like a keeping up with the Joneses type.
It's almost like joining a fraternity in college.
Like you don't need to, but it sounds cool, I guess, if you do.
Yeah, right? You can. But I was just like, I'm not really, you know, I just am not into like the academic side of medicine. I just, you know, I'm really into the clinical and then maybe like this more educational part, but non-academic wise. But yeah, I was pretty impressed with that. And it'll be interesting to see if like that brings about other societies coming out and saying that. Because, and I'm going to go back to, you know, why I'm against, and this is specifically for kids, right? So obviously if you're an adult and you want to go to gender transition, best wishes. That's great. I mean, I firmly believe that an adult can obviously do whatever they want with their own body and have no problems with that. But when it comes specifically to kids, and I'm going to say the same points that I said a year and a half ago, I mean, I am against doing hormone therapy or surgery in kids for some very good reasons, some of which we touched about. One, desysting. So desysting is when somebody that has gender dysphoria reverses their opinion. Like they're like, okay, I don't want to change anymore. So the desist rates is much higher in kids than adults. I mean, we talked about that last time, that there's some studies that show that actually some studies show it's very high. Others show it's, you know, maybe not quite that high, but it's definitely higher than it is for adults. The research supporting it is pretty thin and low. We talked about that. Other people have talked about that. It's kind of cool to be validated. And one of my big ones is that minors, so you know, kids, can't themselves legally consent to a treatment that is, for all intents and purposes, irreversible and life-altering.
Life-changing.
Life-changing.
There's so many things that children cannot do that are life-changing. They can't drive cars until they're 16. They can't get married until they're 18.
Right. Go to war. Like work in a factory. I mean, you know, there's a lot of like potentially.
Like there's all these rules with everything else.
For protection.
That are life-changing decisions that adolescents cannot make.
Yeah.
They're not supposed to.
And then one of the things that I talked about, I have one last clip that I want to show. And what I'm going to talk about in this clip is related to what we were just talking about with the fact that kids can't consent and that I had concerns about that. So roll that clip. The second reason is I worry about the legal implications down the road. And, you know, and not to say that, you know, I'm making this decision because I'm watching out for myself, but just I see the potential lawsuits down the road because...
Well, you run a business, so it's like...
Right. I mean, as a surgeon, you know, I do occasionally review cases for malpractice for plaintiffs because I like to make sure that plastic surgery is done properly. And so, you know, in an instance where a lawsuit came up where somebody 10 years after surgery said, you know, my life is ruined because I had this and this doctor did this to me.
Took advantage of me or something.
Right, this doctor did this to me and I was a child. How could I have consented to that? What would I say? I mean, of course there are the fact that they have to go see psychiatrists and there's all that. But still, like at the end of the day, they're right. I mean, they can't make... So, I was worried about the malpractice potential. Since that episode aired, there has now been over 24 lawsuits filed in the United States for patients that were had transitioned either hormone therapy or surgery or both, and are now suing as adults.
Yeah.
Over 24.
Because they don't like how they
because they feel like that they were, you know, coerced into it, manipulated. They couldn't give consent, like all of it, like all of those things. I feel like
they should be suing their parents.
Yeah, I mean, I guess
the parents are the ones that were holding their hand.
It's a lot of like
it.
multiple lawsuits against medical facilities. Like there's one doctor in one facility out in California that's got like multiple lawsuits against them, you know, all for the same thing. That they basically they had a 30-minute consult, you know, talking about this, and then they had their breast cut off, and now like they, you know, they're unhappy with that.
Yeah.
You know, and they were kids, you know. So, So anyway, it's kind of like, and I think that there'll be a lot more, because obviously a kid's not going to sue someone, right? You have to be an adult to do that. So,
Oh, really? You have to be.
Yeah, right. So
that's another thing. You have to be an adult to sue somebody and make a life-changing decision.
Yeah, because the parents aren't going to sue for the kids, right? Because the parents are the ones that actually, were the ones that gave the consent. But I foresee kids that might have gotten this, a few years ago, like 5 or 6 years in the future, which are the cases that are popping up now that were done 5 or 6 years ago, and now they're adults and they regret this, and they were a kid. They might say, I didn't even know it was going on, because I was a child. Like, how could I have known what was happening? And now they're suing, and I think they're going to win. I mean, and then I think that'll be the end of this. I mean, once, in fact, I actually read this and I had no idea. Apparently, there's a lot of malpractice carriers that strictly forbid doing transition surgeries on kids. Like, it's an actual exemption, I guess is the right word.
Yeah.
Where like, okay, we'll give you malpractice insurance, but it doesn't cover this.
Yeah. Well, it's just, it's strange that that's like they have to go see a psychologist, and I'm like, shouldn't a child psychologist know how temperamental a child's brain is?
I mean, I think a lot of people do. Honestly, I mean,
it's like they make irrational decisions because they're a child.
It seems like a very common sense thing. I agree with you. I think it seems like and I think I think the majority of people agree with that. I just think that the people that are for this are a very vocal crowd.
Yeah, like 1 minute, Avery, my daughter, wants to dress up like a fox. The next minute, like next 2 weeks, done with it. And I bought her a little mask.
You bought like all this stuff.
Yeah, and now she just doesn't give a crap about it. So it's like.
Yeah. I mean, I wonder, I mean, it's funny, like I kind of follow some of these people online who are very pro this, and like they don't have kids themselves. Like, it's like, I mean, I think a lot of people, some of these people just don't realize exactly what you said.
They think it's like
kids are whimsical. Like,
they think with with their emotions more than.
And they might think of something, and it may not be a week or 2 weeks. Like with the example, it may be like a year, but then it like goes away, and so you can't make life-altering decisions based on how a kid is acting. I just think it's just overall bad for numerous reasons, and I do think that. I would predict that in the next 5 years or so, this will be pretty unheard of. Because I think that, the data is going to come out that shows that there are significant risks, there's a lot of desistance, and I think there's going to be a lot of lawsuits, and then suddenly it's just going to be like swept under the rug. Like, this never happened.
Yeah.
It'll be interesting to see these medical societies, what they say about it, if that happens. People don't like to admit when they're wrong.
Yeah.
And I firmly believe that what we're seeing now, where there's this backward shift, is going to continue and maybe accelerate.
Yeah, I hope that happens.
Yeah, I mean, I would too. I mean, I feel bad for the kids that, suddenly you're 20, 25 years old, and like you're very unhappy because all this happened to you, and you didn't really have a say in it.
Yeah.
That's bad. So, all right, big topic. Trovis stayed out of it. He's quiet in there.
I let the professionals have it. Oh, good, man.